Substance misuse. The age of 12 to 17 years old are a critical risk period for the initiation of substance use in adolescence. Many young people use drugs to cope with the social and psychological challenges they may experience during different phases of their development from adolescence to adulthood. Research indicates that cognitive behavioral therapy is effective in the treatment of adolescent substance misuse. However, the combination of CBT with motivational enhancement therapy is equally effective, but also ensures that teenage clients are motivated to change their behavior and committed to treatment before CBT begins. The research on using CBT with kids and youth. Cognitive behavioral therapy gained prominence in the mid to late 1970s. The gradual expansion and development of existing behavioral interventions eventually led to the multifaceted and extensively practiced CBT that we are familiar with today. Initially developed for use with adults, it was important to consider the ways in which CBT could best be adapted for use with children and adolescents. Key theories of cognitive development suggest that by the time most children reach their teenage years, they were cognitively equipped to deal with abstract concepts, to understand that these can be manipulated and discussed, and to compare information from different sources in order to make decisions. Durlach undertook an extensive meta-analysis of the effects of age on the effectiveness of CBT. Analysis of 64 studies involving children between the age of 4 to 13 revealed that while CBT was effective in all age groups, the effect size for children at the formal operational stage around the ages of 11 to 13 was twice that obtained for younger children in the preparational stage. Results from this analysis suggest that in order for CBT to be effective, it was necessary to adapt and present material at a suitable developmental level. In this way, abstract concepts could be translated into simple age-appropriate media such as art or play. CBT for adults is a predominantly verbal process. For use with children, the approach can be modified to incorporate simpler language, metaphors, and visual aids. Metaphors provide alternative methods by which new and complex concepts can be presented to children in concrete, understandable ways. Barrett described unhelpful thoughts as thought invaders, which children are encouraged to destroy, while Williams used the analogy of an annoying song that keeps popping into one's mind to explain intrusive thoughts. Today's children and adolescents are the first generation to have truly grown up in a technology-driven world, with computers, smartphones, laptops, and computer games becoming a part of everyday life. Researchers investigated whether the use of familiar technology could be beneficial in the psychological treatment of young people. Although computer-based CBT treatments are often met with ambivalence and skepticism, initial research suggests that technology may offer opportunities to enhance face-to-face CBT practice and to reach children for whom attending therapy is not possible. A case study by March examined the efficacy on an internet-based CBT program for anxiety disorders on a 4-year-old girl. The program comprised of 10 child sessions and 6 parent sessions, during which child and parent responses were recorded online. These were then accessed by a child therapist who would review responses and send regular messages of reinforcement, encouragement, and assistance. Following treatment, the subject was no longer selectively mute and levels of anxiety had been reduced. While recent investigations into technology-driven CBT have indicated potential benefits, the effectiveness of technology-based CBT is yet to be established and is by no means suitable for every case.